Okay. All right. So you ship to the Caribbean. I'm from Trinidad and Tobago.
Yes, we ship worldwide.
Nice. Okay.
Okay.
Thank you so much.
No, you're more than welcome. I
You're
appreciate you
doing a
coming.
wonderful job. Thank you.
Okay, thank you so much. Nice talking to you.
Yes.
Okay.
So Eric V asks, what about insulin resistance? Eyesight being affected by?
So anything your eyesight's affected by, I think, has to be dealt with in the eye, um, especially if the eye situation is that you're suffering some type of negative impact. So you've got dry eye. Insulin resistance is a big term. It seems to cover everything on earth. So if you're diabetic, you're insulin resistant. If you have heart disease, you're insulin resistant. If you have a stub toe, you're insulin resistant. It just, there is a way that it applies across the board, but there's no way to, that I'm aware of, I'm just going to say it that way, that I'm aware of, to specifically fight insulin resistance in the eye system. There is a way to fight dryness in the eye system, lack of blood flow in the eye system, lack of focus, lack of clarity, growths in the eye like pingacula and tegerium, various other issues, immune system issues like retinitis pigmentosa. So there are ways to deal with those particular issues in the eye, but I don't have a methodology in my mind that I've come across so far that's dealing specifically with something called insulin resistance. I think insulin resistance is the reasoning behind all those other things. So it is the reason behind your eye's inability to maintain moisture, to maintain blood flow, so on and so on.
Okay, Eric V also asks, what about parasites in the eyes affecting the eyesight? And of course,
So
my question back was, how do you know is parasites versus floaters or something else? So what I asked, what are your eyes experiencing?
yeah, from a parasite standpoint, if you're talking about something like acanthamoeba keratitis, I'm with you 100%. I don't have a methodology for dealing with that particular issue of amoebas that are actually in the eye and eating away at the cornea. However, most people believe that floaters are parasites in the eye, and they are not parasites in the eye. If you don't have a diagnosis of a particular parasite that is in your eye, then I would assume you don't have parasites in the eye. You can do all kinds of cleanses that will actually cleanse parasites out of the body. You need to be cautious and conscious of any cleanse that you do, because many of the parasites that are in our bodies are meant to be there and they're supportive of our body's health. So you can't just wash away parasites willy nilly. You need to make sure you're feeding your gut microbiome properly, that you're feeding your oral microbiome properly. I believe your eyes have a microbiome also. So you don't want to just wash it all away. What you want to do is be strategic and actually be looking to move something out of your body for a particular targeted reason and have the right tools to make that work. So the right herbs, the right spices, all the right stuff to actually push whatever you want out of your body, and not negatively impact the good microbes that live in our gut. Okay, let me see. All right.
Okay, so Jack and the name behind the brand. If you can go to my picture or the little circle where it has my name at, if you can press that and hit follow, I can resend the message so it hits your inbox. Otherwise, you have to go to message request. That's the only way you're going to end up getting it without following.